Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report wherein patient reported with the pain in the upper right side region. So the cause of the pain was not known and hence patient was referred for the CBCT scan of the first quadrant, that is the upper right side region. We took a CBCT scan of the upper right side. So as you can see, this is the upper right side region. You can see the second premolar, first molar, second molar and third molar. So we'll go for tooth-wise examination. In this, we can as we can see, there's a second molar tooth over here. So we just need to rule out the findings. So as you can see over here, the lamina dura is intact. The PDL space appears to be normal. There's no widening of PDL space. But however, initial chances of cervical abrasion may start to happen on the labial or the buccal aspect. The palatal aspect over here shows some kind of radiolucency, which is nothing but the artifacts due to the restoration that is noted in the first molar region. Coming as in the second molar region, sorry. Coming to the first molar tooth of concern. So you can see on the mesial root there is evident PDL widening along with periapical pathosis that is noted over here. And the distal, we'll just see in the sagittal cross section. There's a sagittal cross section. You can appreciate it over here. This is the periapical pathosis that is noted, and this is the distal root wherein this you can appreciate PDL widening. And the palatal root, we'll just see the palatal root over here. So you can see the palatal root and the distal buccal root, they seem to combine to each other. Okay, so why this thing has happened? There could be suspected occlusal or you can say cervical abrasion, not cervical abrasion, though not very well evident. Chances of some kind of decay could be evident proximally, but it's not very well evident due to this radio opaque coronal prosthesis. But the crown aspect also needs clinical evaluation. Once with the RBG analysis, you can easily make out the periapical pathosis. So definitely some kind of suspected decay. You can just check this region of interest below the enamel level or the prosthesis restoration if evident. So this needs definitely some kind of treatment. Coming to the root canal treated tooth, that is in the 1-7 region. So as you can see, there are three roots, the mesiobuccal, distobuccal and the palatal, but they seem to fuse to each other. But there is only single evident canal that is noted, which is very common in the second, molar region. Not very common, but it is usually present. So you can just see it over here. The canal is short of apex in the apical 1/3 region, underfill, and hence there is PDL widening that is noted. So this could be one of the cause of the pain. So the first cause which was there was the palatal root pathosis as well as the mesial root pathosis in the first molar, and in the second molar you can see PDL widening due to short of apex. And the main reason for the pain could be because of the deep proximal caries that is noted in the 1/8 region. Now, differential diagnosis, we can always give it as an artifact. You can see artifact evident on the mesial aspect of the tooth, but you can always check it, cross check it once with the RVG or OPG scan and get the findings. So here we'll just increase the thickness also to 8 mm and study 4 mm. You can see very well evident radiolucency, that is deep radiolucency, that is involving the enamel dentina and the pulp. Similar radiolucency is not seen over here. Okay, so definitely we can rule out this is the caries. And also there is evident bone loss that is noted. There is PDL widening which is seen, so kind of endoperioral lesion also you can say. And as for the number of canals, you can always check it by zooming it. So we'll just zoom this region of interest. You can see in the 8 region there are 3 roots, mesiobuccal, distobuccal and the palatal, which seems to be fused to each other. And the canals, you can see it over here. You have a main mesiobuccal, distobuccal and the palatal canal. And then the distobuccal and the palatal canal seems to fuse to each other to have a single exit, and the mesiobuccal canal over here has a single exit over here. So you can just check it out by just zooming in. So this is the mesiobuccal canal and this is the union of distobuccal and the palatal canal over here. PDL widening as seen is very well evident, interdental bone loss is evident, and deep proximal caries is well evident. Okay, so this was a case report wherein patient had reported with the pain in the upper first quadrant region that and hence needs evaluation for these three teeth. Okay, thank you so much.